Welcome to the Call the Vet Show, the podcast that helps pet parents understand and optimize the health of their furry family so they can live the full and happy life you want for them. And here's your host, veterinarian Dr. Alex Avery.
Hello, kia ora. Welcome back to another episode of the show. We're dealing with a really common problem today. A question from worried pet parent Jan, whose young dog has developed or just been diagnosed with a potentially very serious life-impacting condition. But fear not, there is definitely hope, and hopefully I will be able to give Jan some comfort and some action steps to take forward. But the reason that this question is so important for every pet parent is that it's going to help talk about how we deal with with long-term conditions, how we can best go about managing those no matter what the condition is. And I also applaud Jan for wanting to take action now when maybe the problem isn't severe as it will be in the future, because the earlier we take action, the more impact we can have on the health, the well-being, the quality of life of our pets. So even if your dog, if your cat isn't faced with the condition we're talking about today, there are vital lessons for all of us. So without further ado, make sure you hit that follow and subscribe button, whatever you're listening to this on, and let's jump in to today's question.
And now, on with the show.
I just found out my dog has elbow dysplasia. He's 3 years old. What are your typical, an action plan that you typically would do? I heard the surgery isn't very reliable as far as cost and what the results truly are. Any advice is appreciated. Thanks.
Thank you for your question, Jan, and I'm sorry to hear that your dog has been diagnosed with this condition at such a young age. For those who don't know, elbow dysplasia, it's when effectively the bones of the elbow don't grow normally, in inverted commas, and so you get a misalignment, you get uneven wear, stress points, and this is painful. Certainly can be very painful. Depends on how severe this is. But regardless, it also predisposes a dog to developing arthritis, and not just when they're old. Depending on the severity, they may develop arthritis very, very quickly. And at 3 years of age, it may well be that a dog, and I don't know if this is your dog, Jan, but already has some fairly significant arthritis within that elbow. While we're talking about elbow dysplasia, a lot of what I'm going to say is going to be relevant to dogs with hip dysplasia, where the hips aren't formed properly, with cruciate ligament rupture, where there's been some kind of damage to a joint, a traumatic event, or a dog with arthritis because of, again, in inverted commas, old age and general wear and tear without a specific initiating event or underlying condition. And we'll come on to surgery in a little bit, Jan, but I think we need to think about how we are wanting to tackle any chronic condition like this. And we do this through what we call a multimodal approach, which is where we take all of the different aspects of a dog's life, of all of the different ways that we can keep them comfortable, we can impact their health, where we can impact that condition, and we do all of these little things that add up to make a much bigger difference than the sum of their parts, if you like. So when we're thinking about arthritis, we're thinking about chronic pain conditions, even in cases potentially like this where there isn't already significant arthritis present, the earlier we make all of these changes, or as many changes as are appropriate and as you're able to do, the more benefit we're going to have over the long term. So the first and foremost is weight management. So if a dog or a cat is carrying too much weight, then we know that losing as little as 6% of their body weight can make a huge impact on their pain levels. We then think of nutrition. So, for example, in conditions like this, we think of maybe a therapeutic joint diet, something like Hill's JD, which has been clinically proven to improve comfort in our pets. We can think of dietary supplementation. So those supplements are generally already included in our joint diets. The most important dietary supplement are omega-3 essential fatty acids, which come from a marine source, not from a plant-based, a land-based, plant-based source. Glucosamine and chondroitin may have a benefit, but our omega-3s are really important. If we're feeding a diet with these already added, we don't need to then add extra supplementation. We need to think of environmental modification. So we want to avoid slippery floors. We want to maybe be using ramps or steps up onto, the sofa, for example. We want to be, just modifying that environment to make it as easy and as comfortable as possible for that individual, and allow them to live their life without, having to jump up anywhere, without the risk of slipping and sliding and tweaking painful joints. We need to think of exercise management. So we don't want to be encouraging activities where there are really explosive events. So by that, I mean jumping. So, even jumping into the car, but, jumping, twisting, accelerating, rapid braking. So things like ball chuckers and encouraging ball chasing really are kind of public enemy number one, if you like, when it comes to exercise. Exercise is important. We don't want to just kind of shut these individuals away so that they're not putting any weights through their joints. Exercise is important for muscle maintenance, but we just want to make sure that it is as low impact, as low stress as possible. And generally, regular, shorter periods of exercise are much better than longer intermittent exercise with these guys. And then we've got our complementary therapies, so things like hydrotherapy, physio and rehabilitation therapies are really important for helping to kind of keep our joints range of motion as optimal as possible, and also probably more importantly to maintain that muscle mass, because the muscles will help to kind of stabilize the joint and help a dog carry themselves properly as well. Often if we've got, say, a painful elbow, then the gait of that dog is going to change, and that's going to put stress and strain through other parts of their body, which may also become uncomfortable. And so, physio and hydrotherapy are really good at addressing those problems as well. So, that would be a very brief run through of what a treatment and management plan might look like for the long term. And then the obvious addition to that is also painkillers. So painkillers are really important, and they provide the best opportunity for a dog in pain to become comfortable again. Now, it may well be that some dogs will need this on a constant basis, on a daily basis, or whatever the interval is for the particular treatment. And we do have daily, we have, I believe there's a new weekly anti-inflammatory painkiller that comes that's just been released. There is a monthly one that's a tablet. There is our injections. There's lots of different options when it comes to painkillers, but some dogs will need it all the time for the rest of their life to be as comfortable as possible. If we're doing all the other things that I've spoken about, it may be that we can get away with reducing the dose. It may also be that actually once we've given a course of painkillers to help reset the system, if you like, to get a dog back to being comfortable, to reversing the sensitization of the nerves that happens in long-term pain, it may well be that actually we can then get away with doing all of the other things and not needing painkillers for a period of time. Now, that might be months, it might be years. It's going to depend on the individual. But that's then going to lead into, how we can think about we're managing this from a long-term point of view, not just for the next week, month or year. Is we need to put a plan in place. And then I have a kind of a 3M mantra, which is we monitor, we modify, and then we maintain. So we start a plan, we then monitor how well that's doing. Is it doing what we want it to be doing? If it isn't, then we modify that plan appropriately. And then we monitor that and we modify, and we go through that kind of cycle until we get to where we want to be. And then we maintain that plan. So we don't just go, great, our dog is really comfortable now, we can stop doing all the things. we maintain that treatment plan in the long term. And it may well be that we can dial back some of the things. So like I say, it may be that we try dialing back the painkillers that we're giving, but we're then monitoring that still. And the moment that seems to be breaking down, we modify that plan. So we jump back in with the painkillers, or maybe we remove a supplement and actually things seem to deteriorate again. So we need to pop them back onto that supplement. That's just an example, maybe not the best one. And then this, I guess, brings us on to the surgical treatment as well. So depending on what is going on specifically within the elbow, depends on what surgical options there are. There's certainly some that can be carried out arthroscopically to remove kind of flaps of bone. We think of these as like an osteochondrosis type lesions. But we can also go through the whole spectrum and end up with something like a total elbow replacement. Now, this is a fairly kind of novel, fairly new treatment option that may or may not be available in your area. It's certainly a specialist procedure, 100%, and only, in my understanding, relatively few specialists are going to be offering this. And really, it's an option where everything else seems to have failed. So it's a little bit of a salvage procedure at this stage. Now, with all surgeries, there are going to be potential risks, potential complications. And when we're dealing with joint replacement, so total elbow replacement or total hip replacement, some of those complications can be fairly catastrophic, albeit very unlikely. So infection, implant loosening. With elbows, it can be luxation, so dislocation of the elbow can be then challenging to manage afterwards. Now, it's not a surgery that is available where I am. It's certainly not something that any of my patients have had. So I am not aware of all of the ins and outs of percentages of recovery. And I think that's something that's going to become more readily available as time goes on and more dogs have had this procedure carried out. I would encourage you, if you're thinking about that, to certainly go and consult with a specialist surgeon to see if that is an appropriate option for your dog. It may be that they want to have CT imaging take place beforehand. What a CT does, CT is a great way of imaging bone and then producing a kind of a 3D image that can be examined from all angles to really dial in what is going on with that elbow and to work out what the best plan is from a surgical point of view. It may be that there's arthroscopic options that need to be explored, like I say, but even if we're doing all of those things, we're still going to need to then be thinking about all of the other things that I've spoken about so that we can really optimize the health for a long-term outcome.
Helping your pet live the happy, healthy life they deserve.
Now, that's quite a lot of information that I've gone through and really kind of summarized at the very top level. I've got a lot of links and resources available that I'll leave linked in the description to this episode. So make sure you check those out. And until the next episode, I'm veterinarian Dr. Alex. This is the Call the Vet Show, because they're family.
That's it for this episode of the Call the Vet Show. Be sure to visit callthevet.org to join the conversation, access the show notes, and discover our fantastic bonus content. We'll see you next time.